I'm Dr. Goh Hui Yi and from ParkCity Medical Centre. I'm one of the consultant obstetricians and gynecologists.
I'm Dr. Tan Yan Liang, consultant general surgeon in ParkCity from day one.
I'm Dr. Rajini Sarvanandan. I'm a consultant developmental and general pediatrician at the Child Development Centre in ParkCity Medical Centre.
I'm Dr. Jaspal. I'm a consultant obstetrician here at ParkCity Medical Centre.
I'm Dr. Chong. I'm a consultant cardiologist working in ParkCity Medical Centre.
My name is Dr. Salehuddin Samsudin. I'm a consultant pediatrician and neonatologist at ParkCity Medical Centre.
I'm Dr. Lau Jiwei, a colorectal surgeon in ParkCity Medical Centre.
My name is Dr. Lee Chi Kwan. I'm a consultant orthopedic surgeon at ParkCity Medical Centre.
The first day was a Wednesday. It was the 12th of December 2012, and there were just 8 of us here. So all I remember is coming to work and looking around my clinic, looking out the window, sitting there, waiting for time to pass, and then going home because there were absolutely no patients. And that was the first day, the second day, and the third day. 0 patients.
Patients actually were hesitant to be treated in our hospital, and some patients had to be referred elsewhere because we didn't have the necessary equipment.
First experience in this hospital was traumatic because this hospital used HMIS paperless system, meaning there's no return case notes or operation record. Everything is computerized. I used to do operation like for half an hour, counting, and then spend 2 hours doing computer work. It was really an uphill struggle. And as it progresses till now, I can do a thyroid in 2 hours and spend only 15 minutes doing computer work. So that is progress.
My first day in this ParkCity Medical Centre was a brand new hospital. It was very exciting, and just come back from UK. It's the very first hospital I worked in Malaysia, and I had a lot of plans to make this one of the best children's hospitals or best children's department in Malaysia, actually.
Walking into ParkCity Medical Centre before it started operations gave a good vibe. The open feel of the place, the amount of natural light flooding in, and the presence of windows in the imaging department was so very upbeat. Looking out from the main entrance of the imaging department is the garden courtyard. What better way to get a pick-me-up on a busy day? So it was with a regular patient of mine. He decided to have surgery in this hospital because he liked the open space. He could be seen enjoying the garden courtyard with his drip stand post-op or reading newspapers in the lobby, again with his drip stand in tow. A friendly way for him just made your heart smile.
First day in PMC, if we back on the day we opened, that is on the 12th of December 2012. At that time, I'm one of the doctors who joined in early. So the moment we reach this hospital, the thing that catch my attention the most will be the gardens inside the hospital. Remember, there are 3 gardens, one on the 1st floor, one on the 3rd floor, and the other on the 8th floor. So having a garden concept inside the hospital is something refreshing and something that make me very excited because never have seen any hospital in this country having this concept.
Remembering my first patient, it was on 12/12/2012. It was also the first delivery for the hospital. Every time we celebrate the anniversary, it always brings back fond memories of that patient because we also get her and her family to join us in the celebration.
I remember a few years ago, I had a patient that came in with intestinal obstruction. He was in bad shape with severe infection, heart failure and kidney failure. We told the family that he might not be able to make it. After surgery, we treated the patient in ICU for more than a month. The day when he walked out of the hospital is a day that I will never forget. He was so grateful to us and wanted to get us something. But I told him, the fact that you are alive now is the best gift ever.
We treat a whole community, so I've ended up seeing whole families across generations, and I might see a lady and deliver her, and then her mother comes and sees me for a pap smear, and then I may find something wrong with her mom and then operate on her mom, and then they refer to their cousins and and their other siblings, and I ended up delivering many grandchildren in one whole family. So that's actually really, really nice. And over the years now, it's been almost a decade. It's nice to see them come back and to then ask, how is everybody else? And it feels more like a family than just patient-doctor.
We continue to build relationships with the families that we work with. It's really nice to see that many of us have been here from the start, and that many of us have continued to develop services together. And what's exciting is that we have been given the opportunities to develop the Child Development Centre. Not many private institutions have this facility.
Now, things have changed so much. We get a lot of referrals from other hospitals all over Malaysia. That is because our hospital has invested in the equipment that we need. For example, we are one of the very few private hospitals in Malaysia with endo-anal ultrasound, manometry, and MRI tachography.
Healing in medicine is more than just the physical, something we should always keep in mind when we are dealing with patients. The unique bond, the camaraderie and teamwork of the pioneering staff and doctors are unique. You would only know this if you were part of the group that worked towards making the hospital operational in the run-up to the 12th December 2012 auspicious date.
That feeling, that emotional bond has obviously stayed with me since the first day I came to the hospital until now, and I hope that fire, that enthusiasm will remain with me for as long as I work here.
Seeing the hospital grow has been like seeing a child develop from a baby to an adult, and it's very exciting because we know that we can help more and more patients in future.
The biggest challenge, and I think that has been with everyone for the last couple of years, has been COVID-19. With COVID-19, we had to step up as frontliners to help to reduce the burden to the community and the country. We've also stepped forwards to help the government relieve some of the burdens, bringing in patients from the government side here as well. In all, this experience has been extremely humbling, and it's also shown that how effectively we can work together as a team.
Our ParkCity Medical Centre is going to be a household name around the regions, this area. So I always hope that we can serve the community with the best care that we can provide to the patients and the community, and we eventually become a household for the community here.
I am delighted to be part of this amazing 9 years.